Radial nerve. Radial nerve. The radial nerve arises from the posterior curve of the brachial plexus and receives contribution from the 5 to 8 cervical roots and sometimes T1. It is primarily a motor nerve. It comes in descends into the arm by passing anterior to the latissimus insertion and then into the thoracic of the posterior surface of the humerus approximately 7 to 142 mm distal to the acromion. It lies on the surface of the major head to the pulses rather than the bone surface of the humerus and does not do so until it crosses to the lateral aspect of the humerus along the spiral groove. The lower portion of the radial nerve crosses the midline at an average of 60 cm from the distal articular surface and reaches the lateral intermuscular section at approximately 122 from the lateral epicondyle. The radial nerve is relatively sized, slurring of posterior approach to the humerus. In the posterior approach, the radial nerve is located 13 of 16, proximal to the joint line, or lateral approach to the humerus. The radial nerve is located approximately 7.5 to 10 cm proximal to the lateral epicondyle. Above the eye of the radial nerve innervates the long, lateral, and medial heads of the triceps, 1 to 3 cm distal to the lateral epicondyle and deep to the brachioradialis. The radial nerve splits into the superficial radial nerve and the posterior interosseous nerve. The superficial radial nerve continues down the forearm along the lateral border of the brachioradialis and becomes subcutaneous at its middle margin, innervates the skin of the radial aspect of the forearm and the dorsal aspect of the radial 3 and 1/2 digits. The posterior interosseous nerve continues down the forearm, leading into the supinator and then emerging to split into several branches that supply the extensors of the words and hand. The order of the innervation of the musculature proximal to distal is important in assessing of treatment syndromes of the radial nerve. Clinical and application of radial nerves. Cause of injury of radial nerves in axilla, Saturday night versus crush parts. Fracture shots of humerus most common. Losses 1, 2 most common. Laceration of arm or forearm. Injection injuries. Punish local pressure. Entrapment syndromes. Entrapment syndrome in arm, previous or lateral head triceps. The posterior interosseous nerve is prone to entrapment at several levels by various structures. Classical posterior interosseous nerve entrapment is known as radial tunnel syndrome. The radial tunnel begins shortly after the bifurcation of the radial nerve. The posterior interosseous nerve passes the two fibrous bands that are confluent with the brachialis, brachialis extensor carpi, radialis brevis, and superficial head of the supinator, which forms the most proximal root of the radial tunnel. These fibrous bands are the first structures that may compress the posterior interosseous nerve. Proximally, the floor capsule of the radicapisular joint and the posterior interosseous nerve continues through the tunnel and reaches the level of the radial neck. The root is made as corresponding bases of the radial artery, the lead of Henry in the second structure that may enter the nerve. The posterior interosseous nerve then encounters the extensor carpi radialis brevis and gives us a branch to it. The extensor carpi radialis brevis may compress the nerve of the dislocation. The posterior interosseous nerve passes the neck the short proximal edge of the supinator arcade or branch which is the final location where it may be compressed. Other causes of the strength of being factor dislocation or dislocation of elbow, volcanic ischemic contracture, neoplans, enlarged bursa anomalies, rotatomy synovial of elbow. Radial nerve sensory innervation. Radial nerve palsy example is patient with radial nerve palsy with drop. The radial nerve originates from the posterior cord of the brachial plexus. Posterior cord, radial nerve. Radial nerve injury results from acute trauma of the operation of the radial nerve. Condition is often referred to as Saturday night palsy alcohol sometimes a factor as person falls asleep with the back of their arm compressed by a short back, bar X, etc. Honeymoon palsy from another individual sleeping on one arm overnight compress the nerve. Huge palsy compression on nerve from walking with crutches. Wire nerves supplies the extensor muscles allowing for extension of the wrists and fingers in addition to supplying the triceps that extends the elbow. Extensor muscles, wire nerves. If the muscles are not working properly, the patient will experience the condition known as a wrist drag. Example expression of wire nerve palsy exhibition wrist drag. Normal radial nerve fusion, extension of the wrist, extension of the fingers. Radial nerve injury classically occurs by factors involving the distal third of the humeral shaft, wrist drag. The patient will be unable to perform the recruitment. If the nerve is compressed or the artery tricep muscles will be affected, patient will not be able to extend the elbow in addition to wrist drag. Example is patient with radial nerve palsy due to humeral fracture, scar from repair of humeral fracture. Treatment of radial nerve palsy, breast explained. Physical therapy to help maintain muscle strength and avoid contracture. ENG and nerve studies, brachioradialis force muscles to recover, can be done as early as 3 weeks and follow the progress. Nerve exploration repairs drag. Nerve exploration is indicated in open humeral fracture with radial nerve palsy or even conditions that have had sufficient time without nerve recovery. Tendon transfer is null, cannot be repaired if the fusion cannot be restored.